Good day, everyone. We are here to report about our political advocacy entitled Tackling Neglect of the Older Adults in Scarborough. Our group is called the Fantastic Four, composed of Ms. Shana Marie Alip, Ms. Natividad Lesias, Mr. Jude Miranda, and I myself, Patricia Marie Mojica. First, let's talk about what the topic is all about. We all know that growing old possesses challenges to every human being. These can be categorized into physical, emotional, and social challenges. And I know we are all well aware of the physical challenges that our older adults face. In fact, Toronto Health Profiles reveals that asthma and diabetes have the highest rates of chronic illness for older adults. But that's not all. There are other challenges that require our attention too. In our place of work, we have observed that neglect as one of the challenges that our patients face. These deserve the same amount of attention and care. In fact, it demands more because it can negatively affect the older adults' physical, mental, and social well-being. This neglect is a form of older adult abuse, and 8 to 10% of older adults in the entirety of Ontario experience some form of abuse, and neglect being one of them. According to the census by the Statistics Canada in 2016, 18,195 people, or 16.2% of the populations, are 65 years old and above in Scarborough. With the population aging, this number is expected to double. Thereby, the increasing amount of older adults at risk of experiencing neglect, this is not what they deserve. This is why we've chosen this political advocacy because, as a human being, it is a reflection of the soul to do so. From a moralistic point of view, it is without a doubt the right thing to do. Next, from a healthcare worker's perspective, the well-being of older adults is directly tied to the neglect they are experiencing. There has been evidence that proves older adults that experience neglect tend to have either a stagnated state of physical health or deteriorating one. Which leads me to our last reason. It is to tackle the issue of neglect before it goes deeper and causes more problems for the health of our older adults. To discuss the theories and approaches, here is my groupmate, Mr. Jude Miranda. Thank you.
Theories and approaches. In theories and approaches, Gene Watson's theory of human caring, it says Watson's curative factors in the provision of nursing care. Other one is Erik Erikson's theory of psychosocial development, which is generativity versus stagnation. It says be more connected to one another in the community in order to feel the value and also included despite their limitations. Other one is approach of this political action will be completely revitalize the delivery of nursing care to older adults being present and connected, advocate, and more social relationships. Assessment methods, we use the direct observation, particularly windshield survey. We all know that windshield survey is conducted to provide a visual overview of the community. The condition and trends community that could affect the health of the populations are noted. This data provides background and context for working in the community or for the conducting community assessment. So we noted the presence of numerous nursing home and long-term care facilities. Additionally, gathering of data, we consulting also Canadian statistics and health profiles. Stakeholders and gatekeepers. For our stakeholders and gatekeepers, first is Chartwell, which is the largest operator in Canadian seniors living sector with 200 quality retirement communities in 4 provinces. The other one is Local Health Integration Networks, also known as LIN. It's a non-profit community agency responsible for providing information, referral services, placement coordination services, and case management. And lastly, the Government of Canada. According to Christine Elliott, the Deputy Premier and Minister of Health and Long-Term Care, they will deliver the Government of Ontario's long-term plan to fix and strengthen the public healthcare system by focusing directly on the needs of Ontario patients and families. Ontario government will investing $3.8 billion over 10 years to establish a comprehensive and connected mental health and to support the long-term facilities.
Good day, everyone. Let us continue with the presentation, and let me walk you through one of the springboards of our presentation. Here, we have formulated a three-point plan intended to run over two target settings. The first target setting is the healthcare institutions that focus on dealing with caregiver neglect. The second target setting is the community, where we plan to instill a sense of belongingness in older adults. Another significant aspect of this presentation is the target goals. Our three-point plan is designed to help achieve these long-term goals. First is the healthcare workplace reform. As nursing leaders, we have to raise awareness regarding this matter and put in place measures to reduce it in our workplace. Next is the Adopt a Grandkid program, where grandkids, such as student volunteers or community volunteers, will be invited to older adult healthcare institutions to have interactive social activities with them. To implement it, first, we will need to screen the grandkids, acquire informed consent, then have them engage in socializing activities like baking classes and other activities. Lastly, a culminating activity entitled Young at Heart. Social night will be held. Grandparents and grandkids will participate in talent portions, storytelling, and social activities. For community involvement, everyone will be invited to, together with leaders from the local government and other organizations. Depending on the resources available, activities can be executed quarterly, inviting leaders from the local government that boost ties and build a working relationship for easier communication and support. For ethical and cultural considerations, our three-point plan deals with the elderly, and there are relevant ethical considerations to take note of. Among these is informed consent. Confidentiality is one of the top priorities. We maintain confidentiality at all times, beneficence and non-maleficence, and fidelity. For the cultural considerations, we make sure that cultural sensitivity is a priority, and a survey of cultural backgrounds will be done. During the said implementation, the safety of the elderly will be the top priority. For strengths and weaknesses, to give a holistic overview, we also try to look at the environmental or community factors that benefit the elderly. Based on the Toronto Strategies 2.0 by the Seniors Transition Office, we can conclude that there are various centers that assist the needs of the elderly. It includes caregiving, recreational facilities, rehabilitation facilities, healthcare facilities, and fitness and social programs. These facilities are all available for the elderly. An example is the Access Alliance Multicultural Health and Community Services in Scarborough. There are also various health resources like behavioral support groups, rehabilitation finders, resources, and other resources that focus on ensuring the total well-being of the elderly. Noticeably, most facilities in Scarborough are wheelchair accessible, and buildings and infrastructures are elderly friendly. On the other hand, there are also weaknesses like other communities. Commuting or the transportation system in Scarborough is very inconvenient, and this is a sad fact that affects not only the people but pose a major threat to the elderly in accessing needed facilities or centers. Transportation is very important for the elderly, and this is among those that need to be addressed concerning the elderly being neglected, who often live on their own or who self-supporting. This is an additional burden to them.
Next is our health promotion outcome. First objective is for the older adult to feel more connected and feel more secure and in the presence of healthcare team. The second one is to lobby suggested program local government that give more opportunities for the older adults to create stronger bonds in the community. The third one is to empower older adults to create decisions that contribute their well-being. This will be measured by evaluated through vulnerable nurses assessment, staff conference, and group interviews and feedback form. This political advocacy is for community members of the Scarborough, specifically the older adults, their families, nursing home and a long-term healthcare facility administrator, and the staff, and of course to the local government of Ontario Ministry of Health and Long-Term Healthcare and Ministry of State, Senior. We are all Filipinos in our group and we will form older adults are treated as elder valued for their wisdom and contribution to building our families. We all take great pride in how we treat our lolas and lolas. Without them, we would not be who we are today. They deserve better. It's time to give back, slow down a little, and let them keep up. The neglect they are experiencing right now has affected them emotionally, socially, and psychologically. This is all the reason why we as nurses should act and stand up and do something about it. This is some of all our representation for today. Thank you.